The CAM stands for the Confusion Assessment Method. It's a screening tool, and it was developed in order to identify or screen for something called delirium. Delirium is a dangerous diagnosis, as some people would say. And whether we think it's a diagnosis, a syndrome, or a complex of symptoms, whatever you want to call it, delirium is a dangerous diagnosis. Why? Because delirium has very negative outcomes, increased morbidity as well as mortality. We also think delirium is a dangerous diagnosis because it's easily confused, so to speak, with dementia, which is very different.
Oh, no, I didn't bring him.
Hello,
He's
folks.
all right.
Hi, ma'am.
I don't know where he is.
I'm Dr. Flaherty.
Nice to meet you. I'm Sharon Jones, his wife.
Okay, nice to meet you. Mr. Jones? Mr. Jones, I'm Dr. Flaherty. The nurses asked me to come see you.
Where is Brownie? Where's my dog? Where's
He's
my
okay.
dog?
I've been here all day. He was fine this morning, and this afternoon it's not going so well.
Okay.
He's not very alert.
I've never met him before. Does he, I read his chart and he has Alzheimer's dementia?
That's correct. He's been here about a month.
Oh, okay. Was he ever like this before?
No, not really. He's deteriorated since.
Okay. Let me ask him a couple questions. Mr. Jones, wake up for me. Mr. Jones, tell me what day of the week this is.
Friday.
That's right. Today is Friday. Now tell me what year this is.
Friday.
Okay. Would he normally get that question?
No, he really wouldn't. He usually goes back to like the 1950s, you know,
Where's
repeats
Brownie?
it all the time.
Where is Brownie?
Don't worry about Brownie. He's fine. He's at home.
But at least he would say a year. Let me try
Yeah.
that one time. Mr. Jones, what year is this?
I don't know where my dog is. I don't know where he is.
He's at home.
Let me try one more thing. Mr. Jones, if today is Friday, what was yesterday?
Friday.
Okay.
Friday.
If today's Friday, yesterday would be Thursday. What's the day before Thursday?
Saturday.
Okay, okay. I'm going to try one more thing. The somnolent or lethargic type of delirium is often the most dangerous type because it's often the most unrecognized or missed type. People can go days, sometimes longer, and just be labeled as sleepy or fatigued. So the confusion assessment method really is objective criteria that helps you diagnose delirium when it first begins.
Tuesday. Saturday.
Good. We're going to try it one more time. Mr. Jones, if today is Saturday, I want you to say the days of the week backwards, starting with Saturday.
Saturday. Friday. Saturday.
Okay. One more thing. I would like to try just one little other test here. I'm going to say some letters, Mr. Jones. When I say the letter A, I want you to raise your hand. A. Okay. Of the somnolent lethargic type of delirium, it's pretty clear once you use the CAM. You get a good history from the wife that something has changed recently. He's fluctuating because the wife says he wasn't like this morning. Okay. You get attention tasks. The attention tasks I do, he cannot complete the attention tasks, so that's inattention. He's disorganized. I don't have to ask specific disorganization questions. I asked him orientation questions. And instead of giving me the wrong year, he gave me a very disorganized answer. He kept on the days of the week or the dog. The hyperalert or vigilant type of delirium is rarely missed. This person's usually labeled with agitation. But if you look at the clip we're about to see, the patient's eyes are vigilant. He may not be agitated, but his thinking is just vigilant. So it's as important in this type of patient to do the attention tasks, as you'll see. He's able to start it, but his inattention won't allow him to complete the task.
Okay.
Good, good. All right, let me just a couple more questions and then we'll figure out a way to find Brownie. Tell me what day of the week this is.
Friday.
Right, right. Now tell me what year this is.
Friday.
Okay, okay. One more question, then we'll figure out what to do. I want you to start with Saturday and say the days of the week backwards.
Saturday, Friday, Saturday, Sunday.
The mixed type is another common type of the three types of delirium. What you'll see in the clip is that during part of the interview, he's more lethargic or somnolent. Then he becomes hyperalert, and then he trails off during one of the attention tasks. Mr. Jones, I want to try one other thing. I'm going to say a string of letters. When you hear the letter A, Mr. Jones, when you hear the letter A, I want you to raise your hand. A, good, B, D, T, A. Some patients with delirium may not meet all the criteria for delirium. If they have one or two components, we would call this subsyndromal delirium. We think this has a bad outcome too, because if you don't pick it up early, those people could go on to have full-blown delirium, and again, the medical causes could be overlooked. The clip you're about to see, the patient looks maybe his baseline, except when we do the attention tasks, he's unable to complete them.
I think there's something wrong.
Really? In what way?
He's just not acting the way he normally does.
Physically or more thinking-wise?
Thinking-wise.
Okay. Well, I need to ask you a few questions. Some simple, some a little more difficult. What day of the week is this?
Friday.
Good, good. And what year is this?
1955.
Okay, is that where he is? He's been for a few years?
That's where he's been.
All right. Now do something else for me. I want you to start with Saturday and say the days of the week backwards.
Saturday, Friday, Saturday, Sunday, Monday, Tuesday, Wednesday.
Okay, good, good. Now let's do it this time. Start with Saturday and say the days of the week backwards.
Saturday, Friday, Friday.
I would leave it at this. Delirium is such a dangerous diagnosis, and screening for mental status changes. Screening for the possibility of delirium is so important that mental status should become that sixth vital sign.